How to monitor blood sugar levels at home. Welcome. Today, we'll discuss a crucial aspect of managing type 2 diabetes. How to monitor your blood sugar levels at home effectively. Monitoring is vital for managing diabetes and preventing complications. We'll cover why monitoring is important, the tools you need, how to use them, and tips for optimal results. Importance of monitoring blood sugar. Monitoring your blood sugar levels regularly helps you understand how different foods, activities, and medications affect your blood sugar. It allows you and your healthcare provider to make informed decisions about your diabetes management plan. Consistent monitoring can help you avoid dangerous highs and lows in blood sugar, reduce your risk of complications, and improve your overall quality of life. Tools you need for monitoring. To monitor your blood sugar at home, you'll need a few essential tools. 1. Glucometer, a device that measures blood sugar levels. 2. Test strips, used with the glucometer to analyze your blood sample. 3. Lancet device, a tool to prick your finger and obtain a blood sample. 4. Logbook or app, for recording your readings. How to use a glucometer. Now, let's walk through the steps to use a glucometer. 1. Wash your hands. Clean hands prevent infection and ensure an accurate reading. 2. Prepare the lancet device. Load a new lancet into the device. 3. Insert a test strip. Place a test strip into the glucometer. 4. Prick your finger. Use the lancet device to prick the side of your fingertip. 5. Collect the blood sample. Allow a small drop of blood to form and apply it to the test strip. 6. Read and record the results. Wait for the glucometer to display your blood sugar level, then record it. Optimal times to check your blood sugar. To get a complete picture of your blood sugar levels, check at different times of the day. 1. Fasting blood sugar. First thing in the morning, before eating or drinking. 2. Before meals, to understand your baseline level before eating. 3. 2 hours after meals, to see how your body handles food. 4. Before bed, to ensure your blood sugar levels are stable overnight. Tips for accurate readings. To ensure accurate readings. 1. Use fresh test strips. Check expiration dates regularly. 2. Calibrate your glucometer. Follow manufacturer instructions. 3. Keep hands clean and dry. Residues and moisture can affect readings. 4. Use the right amount of blood. Too little or too much can lead to errors. Understanding your readings. Understanding your reading is crucial. Here are some general guidelines. 1. Normal range, 70,130 mg per deciliter before meals and less than 180 mg per deciliter 2 hours after meals. 2. Hypoglycemia, low blood sugar, below 70 mg per deciliter. 3. Hyperglycemia, high blood sugar, above 180 mg per deciliter after meals or consistently high at other times. If your readings are outside these ranges, consult your healthcare provider for advice on how to adjust your management plan. Keeping a log and sharing with your doctor. Keeping a detailed log of your readings helps you and your doctor spot patterns and make necessary adjustments. Note the date, time, reading, and any factors that might have influenced your blood sugar, such as meals, exercise, or stress. Conclusion. Monitoring your blood sugar levels at home is a powerful tool in managing type 2 diabetes. With the right tools and techniques, you can maintain better control over your health. Remember to keep your healthcare provider informed about your readings and any significant changes. Thank you for watching. If you enjoyed this video, please like, share and subscribe.